Welcome. This is Parenting and Attachment, Autonomy in Middle Childhood. Our research question is as follows. Does parenting style affect the development of autonomy within the child, and does the child's attachment relationship impact that connection? We examine the association between parenting style and autonomous behavior in school-aged children through the lens of attachment theory. Before we begin, these definitions will help better clarify what our research question is all about. Autonomy is described as feeling that one is the origin of one's own actions, that one can determine his or her own behavior. It is also described as self-governance in the service of goals or commitments to people, values, or experiences. For the purposes of our study, we are defining middle childhood as the age range of elementary school children, after kindergarten but before adolescence, a time when children can truly start exhibiting autonomous behavior, make their own decisions, and develop their skills. We examine 4 main parenting styles under our definitions. These definitions and categories are authoritarian, indulgent or permissive, authoritative, and neglectful. The authoritarian parenting style is characterized by high levels of parental control, low levels of parental responsiveness. Parents are non-responsive to child's needs, enforce their demands through power and use of threats. They are oriented towards obedience. Children in these situations usually have little in terms of decision-making ability. The authoritative parenting style is characterized by high levels of parental control and high levels of parental responsiveness. These parents tend to be nurturing and affectionate, set boundaries, discipline through guidance, and have open communication with their children, allowing their children to develop their skills in decision-making. The indulgent parenting style is characterized by low levels of parental control, high levels of parental responsiveness. These parents have few or inconsistent boundaries. They often take the role of a friend rather than a parent that guides their child toward success. Neglectful parenting style. This is characterized by low levels of parental control, low levels of parental responsiveness. These parents are emotionally detached and self-absorbed. They are often inconsistent with their boundaries, and their children have little interaction with them. Our research question looks at parenting style and autonomy in middle childhood through the lens of attachment theory. This stems from the work of John Bowlby, whose work brought to light the importance of the primary caregiver relationship. Mary Ainsworth took Bowlby's theory using an experiment that defined attachment through a stranger's presence in a room along with their primary caregiver. This experiment defined secure attachment as a child being comfortable enough to explore their surroundings with their caregiver as a secure base. This same experiment defined 2 types of insecure attachment: avoidant and ambivalent. Our research on attachment will fill in the gap between infancy and adolescence or adulthood that must be studied. We picked attachment theory because it had the most developed framework for studying the relationship between parents and children. Additionally, attachment is solidified during middle childhood, a pivotal time for a child's development. Our preliminary investigation into the work done so far on attachment and parenting styles shows that both secure attachment and authoritative parenting style lead to positive cognitive development and social development, independence, intrinsic motivation, and success at school. The literature trends point to autonomy best being developed on the parent's part by acknowledging the child's perspective, explaining requests in a way that is meaningful, and avoiding controlling language. This offers the child choices and the ability to make a decision. Autonomy itself gives a sense of initiative that individuals have control over. The literature points to a more responsive parent more likely garnering secure attachment with their children. Authoritative, permissive, and indulgent parenting styles have high levels of responsiveness, leading to secure attachment, whereas authoritarian parenting, low on parental responsiveness, has a lower rate of attachment among children. Permissive and authoritarian parenting styles both remove responsibility from the shoulders of their children. This may affect self-regulation. An authoritative parenting style, however, best develops a child's internalization and enables them to become assertive and develop their sense of autonomy. Balancing their autonomy with their dependence on their parents' presence indicates secure attachment on the part of the child. Insecurely attached children are dependent on their caregivers, difficult social situations, such as school, and for coping in general. Without developed autonomy, a child may have a negative self-view, which underlies disorganized and avoidant attachment. Securely attached children internalize self-soothing behaviors passed down to them from their caregivers, allowing them to be more independent and better relate to their peers, having developed empathy. This shows that secure attachment and autonomy are tightly linked. Surveys show that in nations other than the Western world, attachment is described in a similar manner. Secure attachment is described the same cross-culturally. These behaviors are universally smiled upon due to a parent's desire to see their children flourish. Parenting style, autonomous behavior, and attachment theory. Where these three intersect, there is little research done. What we know so far is that authoritative parenting supports secure attachment and in turn autonomous behavior. Our research would provide evidence supporting our conclusion that secure attachment and the correct parenting style will align to support autonomous behavior in children. Previously conducted studies on autonomy and parenting styles and attachment were conducted in schools. Success in school is difficult to measure outside of letter grades, and in that respect, success in school may not always be connected to a children's direct autonomy. Most of the studies done have been for the middle class and white families. In this sense, autonomy is a luxury for children that live in safe environments and have after-school activities offered. Autonomy must usually be limited in lower socioeconomic families due to the danger of children wandering alone in their neighborhoods. Many of the researchers have a Western bias on a Western idea, attachment, that will inevitably be shown in their studies, especially in non-Western nations. The research has shown attachment to be universal across cultures and across the globe, but many of these studies were done by Western researchers, and their bias has almost certainly skewed those results. Policymakers, agencies, clinicians will use this research to support families with their schooling and hopefully help foster autonomy. Social workers can develop interventions to identify children in middle childhood and increase their autonomy where needed. On a macro level, this may inform policies for social work agencies that will hopefully create programs such as after-school activities that will help foster autonomy.